before we take off, let's just go ahead and kind of recap what the procedure would look like if somebody were to come into you and say, Dr. Struck, I need to get gynecomastia surgery. Would you schedule them? How many follow-ups would you have with them physically? And I ask this because people who might travel out of the state or out of the city, and they come to you or just in general go to a doctor, what can you expect in terms of how many follow-up appointments and whatnot? How does that look?
So yeah, the surgical procedure, like I said, hour. I usually see you the next day to make sure there's no bleeding or significant swelling in there. There will certainly be some swelling. I normally don't use dissolving stitches. I like to take those out. I leave those in a little bit longer because I've had a couple of them open up on me due to swelling and activity. So I might leave those in for 10 days. Okay. So maybe 10 days you have your stitches taken out. I have a guy coming from quite a ways away. I'll put some dissolving stitches in him and some super small skin stitches that he'll be able to remove himself. So 10 days you're having your stitches taken out. Often at a month you'll see people to check, but if the scar is healing well, many people it'll only be those 3 visits. If someone goes into that ropey hypertrophic scar, if you want to look up hypertrophic scar, that's the technical name for it. Someone develops a hypertrophic scar, they might get a steroid injection once every month 3 or 4 times. Okay. So that would be an outlier group where their scar is kind of acting up. But in general, I think it's like 3 visits.
Okay. Yeah. Okay, so pretty quick, pretty painless, pretty easy. Yeah. And that was my experience as well, too. If you're able to get over the fact that, yes, you're going to be awake under local anesthesia for the procedure, then I would suggest that route if you're a bodybuilder who's looking to get the gynecomastia taken out. And of course, getting a doctor's recommendation on what to do is key, but I stress that you guys really do your best to find a doctor who works very honestly, and that's why I came to Dr. Struck. He's a very honest man, and he does not feel the need to overcharge for something that might not be worth that. He values his time, and he values your time, and he finds a nice place in the middle, and he works with you on that. So again, I suggest that if you guys are out of state and you're looking for a doctor and you're not going to be able to travel to a doctor specifically, do your best to talk to multiple doctors and kind of get a feel for how they are as a business person, because that's going to really help you understand the kind of work they're going to put into your body. I was more than pleased with what Dr. Struck did with me, and I really appreciate him taking the time to do this video. So please leave your comments, like it, share it, and hopefully we'll get some good feedback from you guys. Thank you so much, Dr.
Thanks
Struck.
a lot, Nick.
Appreciate it.
It's fun.